Healthcare providers throughout Lane County are banding together in response to recent spikes in STD cases. KEZI 9 News reporter Nana Wins live in the studio to explain how they're trying to attack this situation before things get worse. Nah?
Brian, at the end of last year, Lane County saw an increase in the numbers of gonorrhea and syphilis cases. Reps say this trend continues into this year and with another disease, HIV. The numbers had healthcare providers from all over the area working together to stop the increase.
We do know that the complications of STIs can be very serious.
That's why representatives from throughout the county met up at the Public Health Building this morning.
We had a number of providers here today. We had providers from the University of Oregon, Lane Community College, the two local hospitals were represented.
Compared to this time last year, gonorrhea numbers are more than double, and some believe this could just be the beginning of a huge problem if the issue isn't addressed now.
Having an STD can put you at greater risk for HIV, so it's really something that we think of going hand in hand together. As they said today, STDs travel together.
While one doesn't necessarily cause the other, health workers say there is a correlation, so they weren't surprised when reported HIV cases shot up too. There have been 40 so far this year. That's more than half the total cases for 2012. Health providers think working together can bring those numbers down.
It was an opportunity for us to bring them together. They are the ones who are in the front lines, serving many of the patients. And it's also an opportunity for us to have a consistent message throughout our community.
You know, it's an important message that we all probably know that it's difficult to have conversations with your provider about your sexual history, but it's a really important part of our health. It's really important that people do that so that we can kind of get people to do the testing and treatment that we know needs to be done.
Now, organizers said we often think to do things like get an annual lipid panel during our regular physicals. Getting an STD test should be no different, and it's up to providers to make sure those conversations take place if we want to stop this growing trend. Live in the studio, Nana Win, KEZI 9 News.